Okay. So, hi, CAM followers. Hope you're well. Hope you've had a good day. And thank you so much for joining us this evening. My name's Meg, and I'm really excited to be working with CAM and to welcome this evening's guest, Dr. Caroline. You might have seen her on CAM Lives before, but this evening we'll be talking all things body condition scoring. So what it is, its importance, how to carry it out, and also the relevance in arthritic patients as well. Before we start, I just want to say a huge thank you to one of our sponsors. So I'm just going to share a video here. So this is Big Barker Beds, and again, you've probably seen Hannah mention them before. So they're an incredible company who are carrying out a clinical trial in their bed design, so that it can be specifically marketed to be beneficial for those pets with mobility issues, pain, arthritis, etc. So we're really, really pleased to be working with them because we can then see the outcome of the clinical trials and hopefully help more arthritic and painful pets along the way. So yeah, really, really grateful for their sponsorship. So without further ado, welcome Dr. Caroline. And first of all, would you like to tell everyone a little bit about you, what you do day to day?
So yeah, I'm Dr. Caroline Taylor. I'm a small animal vet in the UK. I'm currently practicing in the South Manchester area. I'm in the clinic a couple of days a week, and my interest in what we can do for overweight pets was sparked during COVID, when instead of working in the clinic, I started working with some of my patients online. So we would have Zoom meetings and chats, and I would go through a short process with each week. We'd work on different aspects and help them with food choices, but also those other things that can help. And it was amazing because not only were they their dogs were losing weight and having more impact than what I can achieve in the clinic, when you can only see them every month or so, and it's always rushed. You never quite have that much time to talk through the issues and work out solutions to what they're facing. What was amazing to see was the impact that it made with them working together. So that's when I launched the Slim Pet Vet.co.uk, and to help more people. There's also, I run a free Facebook group to help people out with diet choices and give them top tips and tricks, really just to help get that weight moving.
I also think that's a really nice idea, because some people, you know, we can access free weight clinics in practice, but not everyone can get there. Not everyone can kind of give their time every week or every 2 weeks to going into practice.
It can be a really stressful process, not only for the owners, but often those dogs, they can be nervous, or if they've got mobility issues, which often comes in hand. It's really closely linked to an aging pet, but often it's not just the age, it's the weight that can have those. It can seem like they've got old before they should have done. You know, they might be, it's like an all-day trip to get them in the car, to get them comfortable, and then to go. It can be a really demoralizing trip to go to get weighed, and then the scales are the same, or they haven't come down, or worse, what inevitably happens, because it can take, you know, many months,
Absolutely,
sometimes years. It can be an ongoing battle. But when you actually do get that result of when, it can be such a satisfying thing to be able to see that they don't need that medication anymore, that they don't need, you know, that they don't need help to get in the car, because it can reverse some of those changes. And that's, you know, and obviously, you know, help them live longer and live a better quality of life as well.
Absolutely. And I suppose, as you said, you know, coming into the clinic every week, weight does fluctuate so much. It's not going to be kind of a totally downhill slope of weight loss as much as we'd like it to be. So
things happen, don't they? And,
Exactly.
often, it's the whole, thinking it might be, what's happened? Why, you see the dogs maybe not that often at the vets as well. It might be, every 6 months or every year. And it's not quite enough to necessarily have the impact that you need to
Yeah.
have.
Yeah.
To make the changes that you do, and often it's not anything that the dog has necessarily done. It's I saw a Labrador recently. It was about 3 or 4, and I was like, oh well, she's gained a kilo. Is there any reason for that? And she was like, oh yeah, I twisted my ankle on the rugby field, so I
Yeah.
couldn't do the same amount. So often it's nothing that the dog has necessarily done. It's
Yeah.
just that slight little change in the environment.
Yeah.
And that it's, or often it's the, oh well, they went to we went on holiday, and they were having maybe different types of food or different regime, and they put the
Yeah.
weight. It's very easy for it to go on and much harder for it to come off, and it often has to be done in a slow and steady way, so to
Yeah.
prevent muscle loss. And we'll go on to sort of the difference between weight loss itself and that risk of muscle loss as well.
Yeah, for sure. So we've had a few people just saying good evening. So just thought I'd mention now, and someone saying good morning actually. So I don't know where you
Oh,
are in the
great. Oh
world,
yeah,
but
I forgot
good
this
morning.
is all around
Yeah.
the world, isn't it? Amazing.
So just thought I'd mention, if anyone's got any questions along the way, please do ask them, and then we can address them along the way. Hopefully we'll cover them all, and if not, we'll have a look at some questions that are left at the end as well. I don't know sort of where you wanted to start, but I guess starting by thinking about what body condition scoring is, and would be a really good way
Yeah,
to.
absolutely. I mean, a lot of people don't necessarily know. I have got a few slides to share later with a bit more details, with some real dogs in, to show you how you can do it, so you can join in. And because I think it can be really helpful to actually get used to body condition scoring other dogs. And then maybe it might be easier to then body condition score your own dog, because we know from studies, even if you've been trained to do it, when it's your own dog, it's very much more difficult to be
Yeah.
objective. So body condition score is usually from 1 to 9, where a normal body condition score is around 4 or 5 out of 9. There are some scales that go from 1 to 5, where obviously 2 or 2.5 or 3, that scale then has half scores, so it's still sort of very similar.
Yeah.
But I tend to use the 1 to 9 point scale, because it's a little bit clearer, those boundaries.
Yeah.
So anything over 6 out of 9 or 7 is considered overweight, and they're considered in the more obese category if they are 8 or 9 out of 9 body condition score. And with those dogs, it is really important not only that you consult with your vet when you're thinking about weight loss, so that or come and join my community, that you do it in a safe way, so that you don't lose weight too quickly, and that they're going to get a really good balanced diet with high enough protein, so we don't lose that weight too quickly. But to go on to body condition score, so the places you need to feel are basically, you feel around your dog's ribs, and you should be able to, and that's with a flat hand, and you should be able to feel your dog's ribs, not necessarily all of them, but certainly the ones towards the back. You should be able to feel them normally without digging your fingers in. The other thing that we do is look from above, and this will come a bit clearer when you can see the pictures later on. But you look from above, and your dog should have a waist. So it should be an hourglass shape. So it goes in just behind the ribs and then out again as it's going towards the thigh muscles at the back, and around the tail head. And then finally, another area that we judge whether they're under or overweight is whether they have a tuck. So the abdominal tuck is actually from the side. So it should go, the chest should be sort of like this, and then it should go up to be thinner. I don't know whether you can see that with just my hands going
Yeah,
thinner as they're getting. Um, and often that tuck is only it can still be present even if your dog is overweight, that abdominal tuck. So they can be 7 out of 9 body condition score, which is significantly overweight, but they can still have that abdominal tuck. So I think that is where people can get confused
for
with,
sure.
oh, well, you can see my dog's waist, but is it really an actual tuck, or is it just, straight across? Obviously, there can be conditions in some older dogs that they can get a swollen tummy. They
Yeah,
can get fluid in their tummy. So we need to sort of distinguish that. But it can be confusing as well, because sometimes you might think your dog has, it goes in a little bit behind the ribs, but they can sometimes get fat deposits around the tail or around the neck, particularly in pugs and French bulldogs. They can get significant fat deposits around their neck. And because they've got a lot of skin folds there, it's sometimes much more difficult to identify. So there is a slightly different chart that we use for pugs, which I'll show you shortly. I'd just like to mention, I don't know if hands up, anyone who's watching. I can't necessarily see any comments at the moment. Or maybe if I click on
there is a
that.
few.
Oh, I
Yeah,
can see loads of comments now. I'll just open it
yeah,
up. Hi there, everyone.
yeah.
I don't know if anyone's heard of the knuckle test. This is something me and Meg were talking about before. So what I'd all like you to do is hold out your hand in front of you like this, doesn't matter which one, and hold it nice and flat. And then with your other hand, I'd like you to run your fingers along the knuckles just here. So hopefully everyone can do that. And then what I'd like you to do is put your hand into a fist and run your knuckles, your hand along your knuckles like that. And then finally, if you turn your hand the other way up, which I can't do now on camera because I'm like that the wrong way, like that, and then run your finger along your inside of your palm, just at the base of the knuckles, and you'll be able to feel the knuckles just about, but you'll be able to feel a little bit of tissue over that. And obviously this is, muscles and sinews, a little bit of a fat pad there. But if you can feel your dog's ribs like that, they're a bit too thin, or they're a greyhound or a whippet, which 3 out of 9 body condition score for a greyhound or a sight hound is completely normal.
Yeah,
If you can feel them like that, that's just right. And if you can feel them like that, then they're overweight. That's just the ribs. So there are 3 areas to look at: the ribs, the abdominal tuck, and the waist. But when you're looking at the ribs, that's what you can do with your dog next to you. You can do that this evening or this morning,
yeah.
and have a look at that. This is an extra addition. This knuckle test, I don't necessarily think is a published thing,
No, I don't think it
but
is.
it's a good sort of rule of thumb and a
Sure.
way of doing it. Something else I heard, now, if you put your your finger on this sort of bit of your hand, you can
Yeah,
just about feel those bones going if you press really hard.
yeah,
But that is obviously, if that is how it is to try and feel your dog's ribs, then they are significantly overweight, and they're probably more like in the sort of 8 to 9
8 to 9. Yeah, and
section.
I
And I
think
think this is something that, what does it all mean? Okay, they're overweight, but how much overweight? And there is actually it has been found out that if they're 6 out of 9 body condition score, then they're around 10% over their ideal weight. 7 out of 9, 20%, 8 out of 9, 30, 9 out of 9, 40% over their ideal weight. And you can actually use that then. That's what we do to work out, okay, this is what your dog's weight is now. This is what their body condition score. And it helps vets and vet nurses and vet physios to work out how much should they weigh, because that's
yeah,
often what we need to use, what their ideal weight is, to work out. Really, that's the weight we should be using for things like calculating anesthetics. but so often we often have to go up with our anaesthetics. And the double whammy for a dog that's overweight is that anaesthetics then accumulate within the fat, and they can have a much slower recovery because of that. So you've got a little bit of a sort of double whammy problem there.
Yeah, and I think we were mentioning a little bit earlier that if you see your dog every day and you see other dogs, you know, out on a walk that might be slightly overweight, you wouldn't necessarily notice that your dog needs to lose weight. So having these body condition scores and knowing the knuckle test just gives you something to work on. And obviously, you know, I don't know about you, but we get clients who, if we mention, oh, they are kind of sitting a little bit higher on the body condition score chart, owners sort of think, you know, oh, okay. But having that visual is really, really helpful so
Yeah.
that they can see.
And actually relating it to the fact that they're 10% or 20% over their ideal body weight,
Yeah,
actually sometimes is, you know, allows you to put a figure on it, you know,
yeah,
and actually go, well, okay, because, you know, it might be that you didn't have your dog as a puppy, or, you know, that
yeah,
typically it's that their ideal weight is probably around what they weighed when they were 1.5 or 2,
yeah,
or just before they were spayed or neutered, or all that sort of thing. But you know, but if you've moved, you know, it's great if you've been to the same vet for the whole time, you haven't moved,
yeah,
because they'll have a weight for the last, you know, 5 years.
yeah,
But, you know, it can be really helpful to have that ongoing check with, and ask your vet, you know, are they the same as they were last year, or have they put weight on? Um, oh, I think there's some people having some issues with the
yeah.
link, aren't there?
Yeah, I think it seems to
Sorry
be
to hear that.
freezing a little bit, but hopefully, it should go onto the CAM Facebook page and YouTube and all be fine for you guys to watch at a later date. So sorry that it does keep freezing, but it should all be there to watch back later. Um, so yeah, no, I think it's a really good way of keeping and booster appointments are really good for keeping up to date with what your pet's weight is. Again, as you said, asking, are they the same as last year? Have they put on? And using that
I think
appointment.
keeping an ideal of what your dog's ideal body weight is, and what their ideal body condition score is,
Yeah,
can really help, because, you know, it can be, you know, over the winter when their coat's longer, it's underneath, you know, and pictures aren't always, you really have to get your hands on
yeah, for sure.
to have a look. But saying that, I have got some pictures
Yeah,
to
no,
share.
it's really helpful to see um sort of real life examples as well, isn't it? Because it is hard, especially when it's your own dog and you see them every day.
Yeah.
So hopefully everyone can see that.
So you'll have to, if anyone wants to write me an email, that's absolutely fine. If they've got any questions about what we're bringing up tonight, body condition score. I'll talk a bit more about the squat challenge later. It will become relevant, just to give a bit of background about what I do and how I can help. I do run a monthly weight body condition score assessment each month, and so it can be really useful to, when you're looking at other dogs, to actually look at what their body condition score is, like, because it can really help. And this is my dog Merlin here who's helping me.
Yeah.
So is my dog overweight? So body condition score is a much better estimate of healthy weight than just using the scales. Or even, you know, a lot of people say, oh, what's the breed average?
Yeah,
Or, you know, even, oh, well, they're not as big as that dog in the park. And obviously that isn't necessarily a very good measure, because 60% of dogs are thought to be over their ideal body weight now. Even more important, if your dog has arthritis or is at risk of arthritis, to keep them at a lean and healthy body weight. Over 50% of dogs, yeah, we think it's around 60% now, are overweight. So looking around at the part doesn't necessarily help, or it's skewed what we see as normal. And then I was talking before, obviously, about how body condition score, BCS, can also help to identify how much our dog is overweight. And that can help to give an idea of, okay, what's our target weight? What's, where should we be aiming for, and how quickly can they lose weight in a safe way? So these are some of the charts that you'll see online. This is one produced by the World Small Animal Veterinary Association. So it's actually the Global Nutrition Committee. So it's not associated with any food company as such. And you have here listed if they're underweight, if they're ideal, you should be able to feel the ribs easily. So they're easily palpable with minimal fat covering. Waist is easily noted and viewed from above, and there is an abdominal tuck present. And then that goes on. If we read out number 7, we've got 7 out of 9 ribs palpable but with difficulty. They have a heavy fat covering, so that's just like on our palm of our hand when we were feeling that. Noticeable fat deposits might be present around the lumbar area, which is around the tail head or the base of the tail. You might not be able to see a waist, or it's barely visible. And interestingly, at 7 out of 9, the abdominal tuck may be present. So that isn't enough. Just because your dog is tucking up doesn't necessarily, you can see with this one, it's sort of straight across, but just because it's going up a little bit doesn't necessarily mean your dog isn't overweight. So it's an estimate. It's similar to BMI, and there's a lot of people that obviously discredit body mass index in people. But at the moment, it is one of the easiest things that we can do patient side, where you don't need any special technical equipment. There's lots of other things that we've got, like DEXA scanners that tell us the exact body fat percentage. But as a rule of thumb, it can be a really good estimate that you can use regularly. Obviously 1 out of 5, 1 out of 9, 1 out of 9 is really better, and it can also help identify what your dog's ideal body weight should be. I'll add this one here because this is the pug body chart, so this can be used for also French bulldogs and that sort of thing. So this is normal just here. I don't know if you can see my arrow. These two are normal, and they have a scale for males and females. And you can see even these dogs here, you can still see a waist there because they've got quite a big rib cage, and it goes in. It's not until they're reaching significantly overweight levels that you actually lose that waist and even that tuck. And they can often have quite a bit of extra subcutaneous fat in these storage areas around their shoulders, and if your dog has particularly pugs, or have any sort of spinal issues or any limb issues, it can be really detrimental to them when they're at these, and obviously they're also increase of breathing difficulties as well.
Absolutely.
In this breed, so that can be really useful. I've got a couple of cases here that have come through the Slimline Canine group, and they're happy to share their pictures. So this is Sammy. He was neutered around 1 year of age, and he does have ongoing orthopedic issues, unfortunately. He was diagnosed with bilateral patellar luxation and bilateral elbow dysplasia when he was just about 18 months. He's managed on carprofen twice daily, which is Rimadyl. And he currently weighs, this is his current weight in these pictures here. So about 35.5, 36 kilos. So obviously, you can guess his body condition from here, but it's quite difficult in these pictures. So we've got some other pictures here, and this just shows the sort of angles that you would need to get to estimate his body condition score. From the side here, ideally, we'd perhaps be that little bit lower with the camera angle. But the other thing to note here, he's because of his markings, they've put this alternate background here against the blue, so it's much easier to see the edges of. You can see it's much more difficult when he's on the wooden decking to be able to see the edges here. So if you all want to have a guess of what you think Sammy's body condition score is. Obviously, I can't see anything here. You'll have to tell me, Meg, when people have made their guess.
I think that's a really important thing to bear in mind as well, is as you're looking at them, having a blank canvas background is actually, you can really see the difference in those pictures. So got someone saying 6, someone saying 7.
Okay. Yeah.
Yeah.
Good estimates there. So then I've just got another image there of the chart that you can see.
So most people saying sort of 7.
7. Okay. Well, they've actually been quite harsh. I actually gave Sammy more of a body condition score of around 6 because you can just about see a waist coming in here. He's got a little bit of extra around his neck. He has got quite a prominent tuck, which is looking good. So yeah, I think, you could say that, definitely argue, 7 as well. So if he was 6 out of 9, he's going to be around 10% over his ideal weight. But I think this is a significant thing really for dogs with arthritis or at the risk of arthritis. His ideal weight at 5 out of 9 body condition score would be, from 35 to 32. We divide. Don't have to worry too much about the calculations because I can help you with that. But we divide the weight in pounds by 1.1 because he's 10% overweight, and then that gives us the ideal weight here. But actually, when you've got a dog with a risk of arthritis, really, we want to be aiming for that lower level of body condition score. So, yeah, you're right. Really, he needs to be losing probably around 20% of his current body weight to reduce his long-term risk of arthritis and make it easier to manage. So he would, if we were working from scratch, we'd be working to an ideal target weight of 32, first of all. And then depending on how we were going and how he was coping, we would then aim for that little bit lower, if we could, at a lower body condition score of about 30 kilos.
I think as well, some people are reluctant to have their dogs on the lower side of weight, but especially in arthritic dogs, it is so important to keep them that bit lighter, isn't it? And
it is. It's really important they don't lose condition and don't lose muscle and strength. But extra tissue around here and around the neck is not muscle. It's and the worry is that this extra tissue, even at that only slight increase in what he should be, is that the subcutaneous fat and any level of excess fat tissue is pro-inflammatory, and that's where the significant, it's not just the wear and tear, extra wear and tear on the joints, it's the fact that this fat is pro-inflammatory. So you're having to give, and I think that's probably one of the biggest factors in weight loss. It's not necessarily that it's less wear and tear on the joints, it's that we're reversing these pro-inflammatory effects once they're at a lower body condition, and that's what can make the difference to not having to give all the painkillers, and or at least delay how long, when the anti-inflammatories are going to be needed. We've got some explanation here. I'll probably have to go through that later. Just importantly to say, this was what his total calorie intake was worked out to be for weight loss, and then obviously it's really important that we use at least 847 calories as a complete diet, and then only 10% in treats So it gives us a ballpark figure of how many calories they need in treats for weight loss. And that can be a really key thing. And those treats,
Yeah.
could be chicken, but, it's going to be a very small amount of chicken of 100
Yeah.
calories, or it could be carrots or broccoli or cauliflower or courgette, and then they can have much larger amounts, which might help with help keeping them full, and that extra fibre will help as well.
Yeah.
So we've got one other case here, Elsa, who's a 2-year-old. We've got all the young dogs, I think, today. I don't know why they're all young dogs we've got. Her current weight is 11.625 or 25.5 pounds. We've got a couple of pictures there. You can see there we just had a slightly different image, and you can see how against that white wall it can be a bit easier to look. We've got a little bit of hair that can get in the way.
Yeah.
And sometimes if your dog does have a very curly or fluffy coat, it can help taking a picture after they've had a bath, so that coat is a little bit less if you are going on body condition scoring from images, from photos. But obviously you don't necessarily have to do that. You can do that from just by feel as well if they've got a really long coat. So any guesses there for Elsa's body condition?
I'll wait for those to come in. I've got a spaniel, and I clipped her last week, and before she was clipped I thought, oh, you need to lose a bit of weight, and then it's amazing what the hair actually was hiding, because actually she's a really good weight. So
I
she's
think
used to
spaniels
have,
can carry sort of these extra sort of, the sort of saddlebags, you could say, around here,
yeah, yeah,
which can make it a bit more difficult to
yeah,
identify. But it's really the tail head that we look at for sort of, and
yeah,
around the neck for sort of extra fat
absolutely,
deposits. Although they can have sometimes, quite a wide, there can be still significant fat deposits around there as well.
yeah. So most everyone's kind of unanimous saying 5.
5, yeah, 5 out of 9, ideal body weight. Absolutely, well done. Everyone can see this tuck here. She's got that waist, and is perfect. So obviously this is going on how many calories that we need for weight loss, and this is what we were working out before. I think the difficulty is there can be such a variety on the food guidelines,
Yeah,
according to how much actually we need to feed in terms of calories. And I can tell you, she was doing, she was reasonably active, running off the lead for sort of half an hour, 40 minutes every day. And then also having other walks during the day and some activities as well at home. So even though you think, she's a working dog because she's a spaniel, but actually she's not doing anywhere near the sort of 3 to 6 hours of work,
yeah,
which would be this much higher level of calorie intake. So really it's moderate low impact she needs. So only just above, the low level. And obviously if your dog is over 8, or depending on the size of dog, it might be even for a large breed dog, really over sort of 5 or 6, they might need this much lower calorie intake. So again, we've got the ideal weight here is 11.6, which we're at. And then we've got the activity factor as well factored in there. So we use a very different method for calculating the amount of calories per day. But again, we should still be only feeding about 10% in treats once we've worked out the calorie amount per day.
yeah. I'm just having a look through some questions. So I think I can put this one on the screen. So Maria just said that she's got a Labrador called Max, age 10, carrying a little tummy weight due to corticosteroid treatment.
Yeah.
Always been careful with weight, sitting at 29 to 30 kilos at the moment. Possibly got a disc problem as well as osteoarthritis now, and vet seems happy with weight. So is there anything that you would suggest in this scenario? I guess if we're thinking about discs and arthritis as well with that weight.
Yeah, it would be worth asking your vet what body condition score they think your dog is, because it might be that she is around 5 out of 9, but it probably is better. And it might be those steroids may have changed the distribution of muscles, or they can cause sort of muscle thinning as well around the abdomen. So sometimes concentrating on sort of muscle strengthening exercises can be really useful.
Yeah.
Don't know if she's in contact with a physio, or hydrotherapy can also be really useful to help with that in a sort of low impact way, particularly in a dog that's 10 years old. Yeah, it can still be really useful to get them on the leaner side of
Yeah.
normal, rather than maintaining them as they are. And I think this actually does. I don't know if there's any other questions at all.
I will have a little look. Lots of people saying that they like the knuckle test as well.
Oh, brilliant. Good.
I guess there's a question about muscle mass in a moment, which I will
Well,
come to.
yeah, and I think that is relevant because body condition score. There is also the it's not necessarily recognised as much, or you might not necessarily it's not as in common usage in terms of muscle condition score, because mostly you don't think of it necessarily. You just think, oh well, they're well covered and that's fine. But particularly as dogs age, they can get this. You can see there's this fat, the skin, and then the fat layer under the skin. And what can happen is that they can still be a little bit. This can be quite a big layer, but they can actually lose this. This is either side of the spine, and they can lose this little bit of muscle in here. Obviously, they're losing muscle from all over their bodies often, because it might be that they've got kidney disease where they're losing, protein in their urine, or they might have other comorbidities like gut disease where they might be losing protein into their gut. So it's not just age related. There can be lots of reasons why they might lose, or cardiac disease, heart disease, can lose this muscle mass. But this is where the location of where we will feel for those changes. So over here, if you can't feel your the spinal process of your dog's back very well, or it's a bit like the spongy bit on your palm, get like that, that's normal. Okay, so that's a normal level of muscle mass. If you can feel it but it's not particularly prominent, then you might still have a little bit of mild muscle loss. If it's a moderate amount of muscle loss, if you can almost see this little ridge, and you can see here in the image, you've got this sort of ridges of the different, and you can see the top of your dog's back is a little bit bumpy. And then often, when they're sort of, really, if they have been really poorly with, a variety of different diseases that causes this protein loss, lots of different diseases can cause that in lots of different systems that in your dog, unfortunately, that obviously can be severe. And when we're looking at weight loss, it's really important that this isn't happening, that we're maintaining a good level of muscle, and yet we're losing, and you can imagine if your dog they can be overweight and yet still lose this muscle.
Yeah.
So it's important to recognize that there is a difference between sort of weight loss in a healthy way and weight loss in an unhealthy way because of that muscle loss.
That loss of condition. Yeah.
Yeah, yeah.
So I guess that feeds into, so Denise asked, my pug has lost muscle mass on his back legs. Can you build this up?
Yeah, so a lot of often with this, if it's muscle loss over, like in these sorts of moderate to severe muscle loss, there's often internal processes. It's really important. Another place you can look at is the head as well, that you can
Yeah.
feel that bony prominence on the head sometimes, or the shoulder blade. But most often in the back leg, unless it's all over, in the back leg, it's usually because of pain, or or one-sided thing. And you can do some things to help. So these things tend to be because of a whole system, your dog's whole body is something going wrong there. Whereas when it's just localized in one area, it might well be because there's some loss of use in that leg. And I think number one priority would be, yes, to get assessed by your vet and make sure that any pain associated with that limb is managed. But second of all, if you can find a local physiotherapist, ideally to work in combination with your vet, to help give you some exercises that you can do to help build that strength in those muscles on the hind leg. Even passive range of movement exercises can be useful. Look through the library here on the CAM website. I mean, there's a huge number of resources with people far more experienced than me in rehab to help with muscle strength. But interestingly, muscle strengthening exercises there was an article yesterday published by the BBC about how muscle strengthening exercises can help reduce your risk of diabetes in people. This is help you live longer, help with weight loss. And so there's no reason to think that those exercises won't also help your dog as well. And it can also, help, obviously, even if your dog can't walk very far, you can do muscle strengthening exercises. So a simple sit to stand, is, if you do that repeatedly with sort of 5 to 10 repetitions, that can help strengthen up their back legs to be able to walk that little bit further. And those sorts of things. Obviously, we need to manage the pain. We need to make sure there isn't any problem with doing these exercises and that you're doing them in the right way. But yeah, that was partly if you want to come and join in the squat challenge that I'm doing in October in my free group, then please come along. I posted my first reel the other day on Instagram. So you can find it there about me doing some squats with my dog Merlin in the garden, and he actually behaved pretty well. So it will be just a way of and it's all going to be for Mission Rabies, because it was World Rabies Day yesterday. So they vaccinate dogs against rabies around the world. So.
No, that sounds brilliant. That's have you got your Instagram handle at the end of?
It's Slim Pet Vet, I think, is you can find me on Instagram.
Lovely.
And yeah, that's my website there, and the free group that I'll be running it in is Slimline Canine. I think it's on this slide here. There we go. October Squat Challenge, as if I'd planned it. There you go. Slimline Canine, Slim Solutions for Overweight Dogs. So yeah, everyone would be welcome there. Whether you've already got your dog to lose weight, or if that is something that you want to work on over the next few months, it's going to be I've enjoyed creating the videos anyway this week with Merlin. So it's hopefully people get behind it and share some what they've been up to with their dogs, because actually it's good for us. With muscle strengthening exercises, we don't have to think of, we've got to get the weights out and do these sorts of things. With us, it would be as simple as stair climbing. For dogs, week one's going to be sit to stand, and then we're going to look at lying down to stand up, and obviously one of those exercises isn't necessarily going to do much, but if you're doing that 5 to 10 times once or twice a day for 30 days, then that can make a significant difference to your dog's general muscle strength, and also help with weight loss. So.
Yeah, absolutely. No, that's great. So I was just thinking about sort of earlier some questions that I was thinking about for you, and I think weight loss, have you got any sort of top tips for how an owner can get the weight down effectively but in a healthy way, so it's controlled and slow. What tips would you kind of give to a
Well,
client?
first of all, we want to be making sure we are picking an appropriate diet, whether taking into account whether how old our dog is. Sometimes just switching them from a standard adult maintenance food to a diet for senior dogs is
Yeah,
enough. If we're reviewing our portion control, our portion size, and looking at where those extras might creep in. Again, just looking at sometimes just simply looking at what extras they are. I know it's been said here before by Hannah, and we're sort of quite guilty of looking at, oh, I'll give this supplement because it's good for joints. And actually, when you look at it, it's actually a chew stick that's, quite high in calorie.
yeah,
And actually, the active ingredient is really quite low.
yeah,
So actually the cost, and that they can be quite costly as well. So actually the cost of these supplements, so-called marketed supplements for our dog's joints, actually we'd be much better off actually concentrating on getting the weight loss down and maybe picking a food that has these joint supplements already in. The food itself might be a bit costlier than another brand of food, but like I don't like mentioning brand names, but things like mobility support, JD, they're
yeah,
shown, and you can even get those as moderate calorie as well. So
yeah,
even if you're giving, oh, well, I'm giving my omega-3 and my omega-6, oh, and I'm also giving them the U-move, and oh, I'm also giving them this, and I'm also giving this joint chew. Actually, all those things just add up, and it's extra calories that your dog is actually then counterproductive to getting the weight down, which is actually going to be one of the key ways of helping you manage the arthritis, because if we can get the weight down, then all those pro-inflammatory mediators that are rolling around in our dog's body are reversed.
yeah.
So it means that we're then not chasing it with all the other things as well. So yeah, I'd pick an appropriate diet. And it can be really, I know food choice is just, there's a myriad of different options there.
There's
But
so much.
even though it says weight control or weight management, I mean, I do lots of research, all different websites, and I'm not a specialist nutritionist, but it would take me another 5 years to qualify. There's only about 5 in the UK.
Yeah,
But what I do know is that even though there's foods that are marketed for weight maintenance, they can vary from around 200 calories per 100 grams to 400 calories per 100
yeah,
grams. So how do you know which is what it is? Because in the UK, they have different rules in the US. So at least the calorie amount is listed on the label.
yeah,
But in the UK, you have to, that's a calculated amount of calories, which seems pretty basic. How
yeah,
many calories is in my dog's dog food? Often it's not even, it can be quite tricky, because if it's, depending on the formulation. So you sometimes have to ring the manufacturer, and obviously you can't do that on the shop floor of the pet food shop. We're looking at
yeah,
deciding what food to give. But in general, if you pick a food, if you're looking for a low calorie food, pick one that's less than 10% in fat, normally 25 to 35% protein. This is dry natter. Wet food is another whole, raw food is another whole thing, because you have to compare dry natter. This is on a dry natter basis.
yeah.
You can see why it's so confusing, because there's not
Really
one
hard.
clear
Yeah,
answer
yeah,
of And the other thing to think about is if your dog is only, I mean, simple things, if your dog is only mildly overweight, so 6 or 7 out of 9 body condition score, it may well be, whatever's happened, it might have taken years, it might have taken months, might have taken weeks, it might have taken their whole life. They might have been overweight for a very long time. Whatever they are currently consuming calorie wise is more than they need, because they've got this extra. So I think the mistake a lot of people make is that they cut the food down and their dog then stops gaining any more weight and they stay nice and overweight at the same level. And I think what they forget is you have to get it down that bit further, and if you think of, you in humans, you can cut it, you can do ridiculous diets that are massively, short on calories. And I think it is difficult because people think that, it's their fault somehow. And it's not their fault, because there's often all these different factors. You went and got injured on the rugby field, or so you couldn't walk your dog as far, or your dog got put on steroids because of its skin disease, or I was looking at I think you might have had Fitbark on these activity monitors, and they realise, obviously dogs with arthritis, they've seen that they do have a lower activity, but dogs with skin allergy have a lower activity level than normal dogs, which I was really surprised about. So there's all these other factors in your dog's life which might be affecting how much energy they're doing out, and obviously the weight itself might be having an effect on how much energy. My dog gets tired, after however long, because maybe his breathing is affected. And I think what's difficult is really the only things that we can do, or at least it used to be, we think the only things we can do is decrease the energies in. That's the only thing. Maybe increase the energies out a little bit, but that's not often something you can do very easily. And a dog with arthritis, because they're already, can only go so far around the park before they can't walk very much further, and that sort of thing. So, but actually, the way we feed our dogs, and that, and how we do it, and not just thinking, oh, well, now I can only give them this many biscuits. Actually thinking, well, how do I give that feed? Do I always have to give it in a bowl? Well, actually, sometimes I'm going to scatter feed outside, or I'm going to do some free work, and those sorts of things can really make a big difference. And it's those sorts of changing habits, not just, oh, I'm going to stop giving him that dentist stick at night, that dental chew at night. And that's gonna, that's gonna have an impact. That's great, because what really annoys me is that these companies that who are creating the weight loss foods, but they're also creating these dental chews. They make them so that they are 10% of the calorie amount,
daily
the daily calorie intake. So they're absolutely right. On the side of the dog food, on the treat bag, that you can give your dog 2 of these, and that is, their a safe amount. But of course, is that the only extra they're getting? Are you getting those extra treats you have to have in your pocket, when to get your dog back when they're messing around at the park and those sorts of things? That's often only, I think, because we've got so many options, haven't we, for chews and treats. And if you go down the supermarket aisle, we've got half of it is the complete dog foods, and then half of it is extras. And so you think, oh, well, I'll give half of that and half of that, but really it should only be 10% of what we're giving our dogs, if that. You don't have to. Or, there's no one there at the end of the dog food aisle trying to sell your dog carrots, but they can be a really good low calorie treat, lots of different vegetables and things like that. Obviously, it can take a bit of persuasion and a work in progress to find out if your dog likes blueberries or strawberries, and whether they like them cut up, or if they like their vegetables softly cooked or steamed, or how they want them, whether they want them with their food or as a separate item, but that can be quite fun finding out, and it's obviously much easier to give them a larger amount of these low calorie vegetables,
Yeah.
because they're it's giving extra fiber,
And keeping them fuller for longer, as we
keeping
sort of
them
said
full for longer,
before.
antioxidants and
Yeah.
things like that as well. But it can be, it can be a really good way. It actually, your dog that doesn't necessarily, if they get used to having them, they see that as a bit of a treat,
As a treat,
because
exactly.
it's novel, and it's,
Yeah.
there's no reason why you can't put blueberries within, a Kong with, something else around it.
Yeah. So I had a comment from Susie. I can't see the full comment, but I think we've just answered it. So she's got a mini Daxi who had surgery for IVDD in January. He's 9 months post-op, greatly improved, around a 6 body condition score. And she says that her vet's always preferred Daxis to be nearer a 4. And then all I can see is, given his inability to exercise as much as before, and I assume the question is kind of what would you suggest? But as you said, the scatter feeding, the vegetable, that will all help with that as well.
I don't know if you can see this, can you, on the camera?
Yeah.
I'm holding it up. This is a fantastic book in terms of enrichment, because I think we're all a bit guilty of thinking, especially in the vet clinic, when we haven't got that much time to discuss these things, we sort of think, oh, well, get yourself, a Kong or a licky mat, and then that'll, that's enrichment. But actually, there's, how many pages is this book? We've got over 200 pages of ideas. It's quite small print.
Yeah.
And it's not just about the food. Yes, sometimes we want to be encouraging foraging and those sorts of things, but it's actually thinking about what in the life of a dog, actually scavenging is, for a dog, that's what they want to do. That's what they were, their ancestors did that around near where our camps and things like that. We also want to think about, mental enrichment, mental stimulation, games and toys and things that make them think, and that might be using their scent work and those sorts of things. But also things like calming enrichment, being independent. It might be, building up that ability to not have you there all the time. Sometimes that can really help. So yeah, that's can be a really good sort of starting point. I've worked with some Dachshunds actually, because they are one of the breeds. Everyone always thinks, oh, it's the Labradors and the maybe Cocker Spaniels who are prone to sort of weight gain. But yeah, Dachshunds have, they certainly think they have one of the genes that's been recognised in dogs to have that they're more likely to get to become overweight. So if you do have one of those breeds, and I think this is probably something I should have said way before in terms of prevention, but and also, if your dog is not so much if they're 6 out of 9, because you can use a standard maintenance diet to enable weight loss. But sometimes you find it's actually easier to use the prescription weight loss diets, because the protein levels will be much, much higher. And the problem is more so for bigger dogs, but it's still important in dogs under 10 kilos. If we're having to restrict the food portions to what they were having. If you're restricting a standard adult maintenance diet, then you're not only restricting the quantity of the important things like protein, but also the quantity of the vitamins and minerals and those sorts of things that they need in tiny amounts, but they still need those every day. And if you're cutting that back, if you're restricting too much of a standard food, then the protein level drops low, and when you can get more problems with sort of begging or scavenging on that sort of thing. And actually they're not as satisfied. So it's a bit like with think of the Atkins diet, something like that. We want to have a diet that's quite high in protein. I don't really go for saying, oh, they should be on an only protein diet, because actually carbohydrate within the diet, particularly in weight loss foods, can be really useful because of the fiber, the indigestible fiber portion. And that's why a lot of the time when you switch on to these weight loss foods, the fiber content is much higher than they've been
Yeah.
used to. So you suddenly think, oh, hang on a minute, we're having to clear up a lot more at the back end. And, you know, it's not, it depends on your dog what they're going to be is suitable, because in Labradors that can really help to help keep them full with that fiber content. We know it helps with gut fill. But in some dogs, I found they're actually better off not necessarily having all kibble diet, but actually a mix of wet food as well, which one you can use in different enrichment ways.
Yeah.
But two, I think that actually helps with the moisture content to help keep them fuller, and the amount is therefore a lot more, rather than having to weigh out, you know, 56 grams of biscuits or whatever. You can actually give them a larger proportion. But, you know, I've had people going, oh, I can't, it's really hard to feed my dog this really small amount. And they've got themselves a weighing bowl. So you didn't have to put the food on the scales. You just put it in the bowl and it weighed the bowl. It weighed the amount of food in it.
The
So it was
amount of
a really
food,
easy
yeah.
way of making sure you were giving the same amount every day, and not too much, not too little. And then I was asking them about, oh, you know, why weren't they covering? And then I actually realised that the bowl, that this weighing bowl was actually quite large. So it was like the
Yeah.
size of a water bowl, and it was
Yeah.
little Jack Russell. So I
Yeah.
said, well, why don't you weigh the food in that bowl, but then put it back in their normal feed bowl? And they did that, and they suddenly felt so much better,
Yeah.
because it's a bit like us. If you want to go on a diet or eat less yourself,
Yeah.
get a
Smaller
smaller
plate.
plate.
Absolutely.
But, you know, it's
It
true. It
does.
makes a difference.
It
So
100% does.
if your dog has to have a certain treat, cut it into smaller pieces, because
Yeah.
dogs don't necessarily, they think, you know, one is good, three is better. You know,
Yeah.
it's all about the repetition. It's not
Yeah.
necessarily about the size.
Absolutely. Susie just then added that to add to his IVDD, he can't tolerate protein, so he's on a prescription diet that's soya based, which makes weight loss even more difficult. So I don't
Yeah.
know about you, but what came to mind then was sort of hydrotherapy for weight loss as well, to combat
Hydro can be
both.
really good. I
Yeah.
mean, how many you do hydrotherapy yourself, Meg?
Yeah.
How do you find it with, obviously, you know, they're not going to be swimming in a big pool, because often
Yeah.
the water treadmill can be really good, because they can still
Absolutely.
then feel
Yeah.
a little bit more in control
Yeah.
than if they're in a pool.
Yeah, so particularly post-spinal patients, we would treat in the treadmill to keep their
Mm,
spine in as straight alignment as
yeah.
possible. But it gives them that buoyancy, that support. Usually there's a therapist in the treadmill with them, and they're
Mm,
getting that cardiovascular fitness with the support on their joints, stability throughout their spine. And that can really help with weight loss. Obviously, you can adjust the water height in a treadmill as
yeah.
well. So if they are really struggling, we can give them that full weightless exercise. But
Yeah.
that cardiovascular fitness ability within water
Mm,
takes that pressure off the joints. So
mm,
for sure, you know, diet can be really difficult, especially if they've got you know, intolerances and things. Then
mm.
I think hydrotherapy comes in really quite well then in terms of
Yeah. I mean, if
osteoarthritis
it's
and
obviously, you know, be led by your own vet as well,
for
in
sure.
terms of, you know, managing other sensitivities. But, you know, you can now get hydrolyzed diets,
Yeah,
which, even if they have got chicken protein, usually they're chicken based within them, they're hydrolyzed, so they're broken up into small fragments so they don't cause allergy.
yeah,
And then you can get those as sort of moderate calorie versions as well. Or there is a prescription weight loss food that I know is fish based. Um, so that can be another option. But obviously, you know, Yeah, some of the soya-based foods can be really good for skin disease, actually.
Yeah.
So it would, there's as long as they're produced by, a good company that has, checks in place to make sure their formulations are proper and balanced, then there's no reason why that you can't continue that long term.
Yeah, absolutely. So I don't think we've had any other questions. The one thing that I was just going to ask you is where you would recommend for everyone to look up body condition scores and get resources. I know there's obviously always lots on the CAM website, but is there anything in particular that you
There
would
is, I mean,
suggest?
straight away download that resource from
Yeah,
the World Small Animal Veterinary Association. That can be
yeah,
really good. There are tips and tricks. There is a new resource from Purina, which, rather than just being in images, a bit like the pug one that I had there, and Royal Canin do different breed sizes. So, if you have a spaniel, they have,
yeah,
that in the photo.
bit more specific.
And the Purina one is actually more like a picture. I don't know whether you can see that very clearly. It's like a
Yeah,
picture of a dog that's then it's a bit more lifelike than
yeah,
just a sort of cartoon image of a dog. Or go and ask at your local vets as well to help
absolutely.
with that. They'll be able to tell you straight away, because it is one of those, even if you've been trained to do it from, is limited to be able to do it from pictures, or
Yeah,
to look at your own dog, because it's very difficult to be objective.
yeah,
So, and also, dogs aren't a typical shape, particularly older dogs. They might be, have
yeah,
a lump here, or that it gets in the way of the ribs, so you can't necessarily feel what the ribs should feel like because there's a lump in the way. A benign mass that's
yeah,
quite common
absolutely.
in older dogs, particularly around the rib cage. Actually, I
Yeah,
don't know if you find that they all seem to be
definitely.
right there, don't they? With the
Yeah,
ribs.
absolutely. But no, thank you so much, and thank you everyone for watching. I think it's been really beneficial, and it's things that people can do at home, not having to take their pet into the practice all the time, and keep a closer eye on it and be more aware of it as well. So yeah, obviously, as always, the CAM website has lots of resources and ideas as well, but obviously everything that Dr. Caroline's mentioned this evening available online, or the book as well. I think that's the only one I had to add is I use the Cognitive Canine Company quite a lot. They've got lots of ideas on their website, and they do like a monthly subscription box if people want to. Lots about foraging, scavenging, and doing it on a budget. So using a rolled up towel or a
It's
cardboard box with,
those
it
sorts
doesn't
of
have to be expensive.
homemade things that you
Yeah,
can change and maybe make
yeah,
easy to begin with, or it's moved. There's so much more you can do rather than just going, oh well, I'll get a
absolutely,
snuffle mat or something like that.
absolutely.
Actually, and see what your dog enjoys doing and what they don't necessarily enjoy doing. They might enjoy more finding a toy, and then that sort of, it doesn't
Yeah,
necessarily have to be with food. Hide and
yeah,
seek. It got desperate measures in COVID. We had to go and play hide and seek with the dog with the
yeah,
family, but he loved it.
yeah, absolutely. I think COVID probably helped in terms of that. Sometimes just getting us all to think outside the box of, um,
Yeah, and
yeah,
I've just seen Susie's comment. I don't know when that, it was probably ages ago actually, about uh, that Dachshunds are quite good beggars, and obviously all dogs
absolutely.
are. And I think that's one of the hardest things that you have to deal with when your dog is on a weight loss diet.
Yeah,
Um, is actually, it's your habits and your um, that you have within and routines that you have within the household that might have to change. it's also other families members' habits, and
Yeah.
they're into the habit of having on a Friday going getting a sausage roll, and the dog has half, and
Yeah.
having to challenge those sorts of oh well, it's only this, it won't hurt, but actually it makes a significant difference for a small dog, particularly because any of those extra little calories can make a huge difference,
Definitely.
over the course. And actually they found that when you do get your dog to lose the weight and they've successfully completed a weight loss plan, actually that begging reduces. And sometimes you think, oh well, how you in your head you think, oh, they're going to be begging and it's really bad. But if you actually just stop or have a plan, okay, if they come to me, I'm going to get my little pot of pre-prepared carrots or courgette out of the fridge and offer that.
Yeah.
If they're hungry, they'll have it. If they're not,
Yeah.
then fine.
Yeah.
They have the choice. And
Absolutely.
having, if they do this, what am I going to do? If they're coming to the table, or you find sometimes it's not necessarily at the table, it's more food prep, isn't it? Food prep
Yeah.
time. They'll sort of be
Absolutely.
lingering, goal hanging right
Yeah.
there, just waiting for that little bit to drop on the floor. If you find that's a really difficult time, again, have something that you can give your dog instead, or play a game before you're doing the prep. Go and play a game and tire them out doing some
Yeah.
activity, and then put them away in their bed so they can
Yeah.
just have a rest. Or it's it might be you might get a few whys to begin with, but it's a different routine because you've taken the time to do whatever enrichment is you're doing that day. And then now food prep time is not the time to have them in the kitchen.
Yeah.
And that those simple things like that, I know it's hard if they're those eyes are looking at you
I know
boring
it's nearly
into your
impossible.
head.
Yeah.
They're it's not their fault, it's their
Yeah.
genes sometimes that it's
Yeah.
driving them to crave, whatever. But those cravings, if you've got them on if you know that the food that you're giving them is providing everything they need, whether it's the the protein levels, then that will help to be able to be strong,
Yeah.
because it's
Absolutely.
your responsibility at the end of the day.
Yeah.
It's not, it's your dog is it's not their responsibility to make the food
Yeah.
choices, it's yours.
Absolutely. No, that's been brilliant. Thank you so much for joining us this evening and for all of your tips. And I'll pop your website in the description afterwards as well, so people can go and visit that.
Come and join me in the squat challenge on
Yeah,
starts on
absolutely.
Monday.
Yeah, no, that's brilliant. Thank you so much, and thank you for everyone tuning in. And yeah, I hope it's been helpful.
Great. Yeah,
Thank you.
really nice to meet you all. Thanks so much. It's always so much a great interaction, and really good questions as well.
Yeah,
It's
absolutely.
really good. Thank you for
Lovely. Thank
having
you
me.
very much.